Okay, I briefly want to talk to you about the Botox, or what is known as botulinum toxin, and fillers. Now, both of these are non-surgical treatments and what we call as injectables. To give you a broad outline, the Botox or botulinum toxin works very well in the upper part of the face. That is, if you draw a line across here, above that line, that's the lower eyelids, the sides of the eye, the brow and the forehead, and the midline part of the face, Botox works extremely well. Whereas the fillers are good for the lower part of the face. That is not to say that we can't use them in other parts of the face, but yes, we can, but we have to be careful. So there are some very basic rules about using botulinum toxins or Botox. Number one, if there is lots of excess skin, Botox doesn't work very well. In other words, often the muscles that tent the skin are weakened by the use of Botox, because that's what Botox does. Botox weakens the muscles. So if you have excess amount of skin, that skin is likely to come down and fall down and give you those bad looks. So I often say to my patients, the wrinkles that form on animation, in other words by moving your muscles, in the absence of excess skin, actually can be treated very well and very nicely with Botox. Now, important thing about Botox is that often people worry about bad results, and the bad results of Botox are related to bad injection. So the results of Botox are only as good as the person who injects Botox in you. So I can assure you, in my practice, we hardly ever see, actually, I don't think we've seen any droopy brows and things like that. It's because we take extreme care as to how we inject. With regards to the fillers, as the name suggests, they just fill the face. They're very good for the folds around here. They sometimes can be used for the jawline. They can be used in the temples or these deep grooves here. But you have to be very careful with fillers. Now, one simple advice with fillers is the fillers, you can have temporary fillers that last for 6 to 9 months. You can have permanent fillers that permanently fill the face. And then you have sort of somewhere in the middle, semi-permanent fillers. What I would say is, I do not recommend the use of permanent fillers. So always go for temporary fillers, and they are what we call as hyaluronic acid based fillers, which are made by various manufacturers. I don't want to go through names of any of the manufacturers. However, hyaluronic acid fillers are your ideal option. Of course, depending on what sort of filler you use and what sort of brand you use, the fillers can work out very cheap or quite expensive. So the higher you pay for the fillers in terms of the branding, you get a better quality, in my opinion. If you again want to talk about fillers, you want to get more detailed information about it, either contact my office or of course do feel free to come and see me.